This video, titled The Least Expensive, Most Effective Mouthwash, is something that you will find is both controversial but also thought-provoking. Because we're going to talk about using sodium hypochlorite, which is an active ingredient in household bleach, as our disinfecting agent. So now let's go to the PowerPoint on that and discuss this as a treatment option. The most effective and least expensive mouthwash, as I've said, is sodium hypochlorite. Before going further, let's review this disclaimer. This information is being provided for educational purposes only and should be used only at your own risk. This is not a prescription, and to emphasize, this should be used at your own risk. Under no circumstances should it be swallowed. Because of that, children, expectant mothers, or women expecting to become pregnant should not use this solution. Sodium hypochlorite has been used by the Center for Disease Control as a way of making contaminated water potable, and they recommend placing 1 teaspoon to a gallon of water. And ladies and gentlemen, that is very, very weak. My exposure to this came in Mexico City in the early 1990s when I was giving a lecture, and one of the other lecturers there was Dr. Jorgen Slotz from the University of Southern California. And he was the one that introduced me to the concept, and he advocated using a 0.05 solution of sodium hypochlorite as an oral rinse. He recommended 1 teaspoon per 16 ounces of water, and he also advocated that you use plain unscented sodium hypochlorite, and below is the reference for this. Disease versus halitosis or health. In a periodontal defect, I think perhaps using the Slotz formula, 1 teaspoon to 16 ounces of water, works quite well. However, if you're fighting halitosis and you want to disinfect the mouth even more thoroughly, I think 1 teaspoon to 32 ounces of water works quite well, and this is the solution that I use in my own mouth on a daily basis. I'd like to emphasize that the amount that you use and the frequency that you use can vary to what you're trying to accomplish. I have found in my mouth that if I use 1 teaspoon to 32 ounces of water on a daily basis, I literally form no plaque. And it's also altered the flora on the posterior third of the tongue, where the sulfur-forming bacteria are that cause halitosis or bad breath. More about that later. Let's talk about some practical considerations. Often when we've completed periodontal treatment, the probing depth is not ideal, and in my opinion, we have converted a periodontal pocket into a periodontal defect. The difference being a pocket is red, has suppuration, and has bleeding on probing. A periodontal defect, on the other hand, has an increased probing depth, but no redness, no suppuration, no bleeding on probing, and there's been no clinical attachment loss over many, many years, and there is crestal density. But if you're going to use a water jet, you need to be careful and not get any splatter, because even in a weak solution like this, 1 teaspoon to 32 ounces of water, quart of water, may inadvertently stain some of your clothes. Now this is very, very important, and I'm going to demonstrate this in a few minutes. Always use a measuring spoon, and we want to use 1 teaspoon, not 1 tablespoon as you see on the right, because more is not better. Remember, as I said earlier, we want to use unscented sodium hypochlorite, and we're going to mix 1 teaspoon to a quart of water. Before using this solution, please go and look at the video, The Importance of Cleaning Your Tongue, which discusses why we want to clean the posterior third of the tongue. And there's several devices out there that can be used to do this, but I think it needs to be a metal device, and the one that I use is made by Dr. Robert Rippich, and you can find his address and where to order this instrument on the video, The Importance of Cleaning Your Tongue. He refers to it as a tongue sweeper, but it's actually a metal tongue scraper. And because of the design, you'll be amazed at how far back on the posterior third of the tongue that you can get without gagging yourself. How do you use this solution? First of all, you need to take about an ounce of it after you have brushed and flossed or done your interdental cleaning, and then place that in your mouth, suck it between your teeth, and then gargle to kill the bacteria in the posterior part of the mouth. And then use the tongue sweeper that we discussed, or the tongue scraper, to actually, with the solution in the mouth, scrape that into the tongue and remove those sulfur-forming bacteria. Then rinse vigorously with plain water, spit that out, and finally, very importantly, I think you need to drink an 8-ounce glass of water. Because if you inadvertently swallowed some of this solution, certainly drinking an 8-ounce glass of water would reduce the concentration to a level where the CDC would be very comfortable with you using that. Now let's talk about the development of bacterial plaque. The acquired pellicle is the first thing that forms, and this is a thin protein-containing film derived from salivary glycoproteins. And this can, if it is removed, it begins to reform in 30 seconds. Now, that acquired pellicle is the matrix for bacteria to attach to, and when bacteria attach to this pellicle, this becomes bacterial plaque. How effective is the water jet in removing bacterial plaque? And this information was provided to me by Lynn Slim, a registered dental hygienist who writes regularly on dental topics to dental hygienists. So the impact of the oral irrigator, she provided me with this systemic review of 914 articles, and it appears that it does not remove visible plaque, but what it does, it improves overall gingival health. In other words, there is less bleeding on probing and certainly reduces the suppuration. So by going in there and using not only a water irrigator, but with this weak solution of sodium hypochlorite, we can go ahead and have a very positive effect on that. And this is the article that she provided for me. It's a very comprehensive article, and it is a systemic review. By using the water pick on residual periodontal defects, and remember, periodontal defects are not periodontal pockets. They are probing depths that are excessive, but the disease is either arrested or non-existent. There's no redness, no suppuration, no bleeding on probing. For many years, there's been no attachment loss. There is crestal density. In other words, the patient is not losing attachment and does not have active disease. However, if you want to get deeper within the sulcus, then you can use the water irrigator to pulse that solution 2 to 3 millimeters subgingivally and disinfect the defect on that. Does the solution degrade over a period of time? Quite frankly, I don't know, but in all probability it does. So even if you have a quart of water, after 2 or 3 weeks, I would discard that and make another solution. We do need to know what side effects may be available. Drinking bleach can cause effects that range from mild to serious depending on the amount ingested. Medline Plus states that consuming diluted bleach or sodium hypochlorite may lead to mild stomach irritation. Ingesting larger amounts can cause some gagging sensation, some burning in the mouth, and perhaps in the throat, or burns in the esophagus. You may also experience chest pains, low blood pressure, slower heart rate, delirium, and it can cause shock, vomiting, and stomach or abdominal pain. So we've given you the disclaimer on the front end, and now we're giving you the side effects here, but I think you can visualize in the solution that we are making, which is very, very weak, that the likelihood of causing any problems is remote. Now, let's go to a little clinical demonstration as to how we mix this up to be sure that you don't get too strong a solution. because you remember, more is not better. Now let's have a clinical demonstration so that you don't make the solution too strong. Here we have a tablespoon and here we have a teaspoon. Look at the difference in the size of them. So we're going to go ahead and just use the teaspoon on that. Here we have a measuring cup, and in it I've placed, as you can see, some sodium hypochlorite. So what I want to do is, before I put it in the water, notice that I dip in here, and what do I have there? Exactly 1 teaspoon. Then I can go to the bottle that I have here and put that in there and stir it up. Think how weak that solution is. The next thing I want to do is I'm going to take, I've already brushed and flossed, I've cleaned interdentally, and then I'm going to take the tongue scraper here, or the tongue sweeper from Dr. Robert Rippich, and then I'm going to take a swallow of this, gargle, empty it out, but I don't rinse. Then I take the tongue scraper and scrape that out. The next thing I want to do is to take a plain glass of water, and drink an 8-ounce glass of water to dilute this so that it will be well below the concentration, if I've happened to swallow some of this, that is recommended by the CDC in making potable water. Please give this a try in your own mouth, and let me tell you what, if you have a problem with halitosis and you follow this regimen, brush, thorough interdental cleansing, and remember there is a video on helpful hints on interdental cleansing, flossing, and some hints on more effective brushing. Look at those 2 videos as well. So if we've removed the plaque on the teeth and we go ahead and scrape the bacteria off the posterior third of the tongue and disinfect the tongue by this solution, you will find that you will have a much fresher smelling breath. Now, you may not be a heavy plaque former, you may not be troubled by malodor, but studies show that 30% of the patients coming into your practice are concerned about malodor. If you're not a heavy plaque former, simply use the tongue scraper without the solution. But the more plaque you build, the more problem that you have with malodor, the more frequently we should use this. And I'll be very honest with you, I use it on a daily basis, and if I skip a day, I am very uncomfortable. It's like I need to take a bath and haven't taken a bath. So go ahead and give it a try. I think you'll be very pleased with the impact it'll have in your own mouth, and certainly a positive impact that it's going to have on patients.